welcome to AMC Doctor. Today in this video, I will be discussing about a sample question that has been given by AMC in their website. So basically, the whole purpose of this video is to understand how the questions are asked for this exam. We will also discuss about how the examiner and role players are instructed for each station. And we'll also have a look at the level of performance that is expected from us for this exam. So by knowing all these factors, we will be able to formulate an approach and prepare accordingly. Now let's look at the sample station. The page you're looking at right now is showing you the question. Let me just read out for you. You are working in a general practice. Your next patient is a 37-year-old woman who suddenly became short of breath at work yesterday. So, in this you can see that every question you will be given a consultation setting and a clinical scenario. So in this case, the consultation setting is a general practice. Sometimes it can be a hospital setting where you will be working as a hospital medical officer. Now, depending on this, you need to tailor your management plan accordingly. Now, the next thing is the clinical scenario. See, in this case, it's a 37-year-old woman and the chief complaint is shortness of breath and the duration is since yesterday. Now, talking about the task, as you can see, the first one is to take a relevant history. The second one is to obtain the relevant physical examination findings from the examiner. And then the third one is to explain to the patient the probable diagnosis and the possible differential diagnosis. So at this point, what I want you guys to focus is that, see, in the first and the third task, so while you're taking history and explaining the diagnosis and differential diagnosis, you are interacting with the patient. So make sure you try to avoid medical terminologies and try to explain or ask questions in simple layman's term. I know this is a very simple and logical advice, but as an international medical graduate whose first language is not English, this task can be quite challenging. So to overcome this, what I recommend is that you can go through a lot of patient education websites where the very common medical conditions are explained in simple language. And you can practice this by doing a lot of role plays and improve this sort of communication. However, for the second task, that is asking relevant examination findings from the examiner, as you are talking directly to the examiner, you can communicate you can use the medical terms for that. Now, moving on to the diagnosis and differential diagnosis, here's a list of causes of shortness of breath given by AMC. So this includes pulmonary embolism, pneumothorax, infections like bacterial or viral, asthma, myocardial infarction, acute left ventricular failure. And there are many other causes of shortness of breath. But because there is a time limit in AMC, what we recommend is that you must rule out and mention, the potentially life-threatening conditions, like in this case, pulmonary embolism, pneumothorax, and MI in the differential diagnosis. And then you can move on to other more common conditions like these infections, asthma, and left ventricular failure. So here is a list of instructions that is given to the role player for each station. Now, based on this, they provide us information to all the questions that we ask in the history taking. So we've got 2 slides for this. You guys can go through them later. However, I have summarized these positive points into a separate slide. So let's have a look at this. So as history of presenting illness, we already know this is a case of shortness of breath. The onset is sudden. Duration, it's since yesterday. The patient complains of sleep being affected and the patient had to sleep sitting up. She still feels breathless, but it has decreased in severity compared to yesterday. And this is the first time that she's experiencing such symptoms. Now, degree, the patient is able to walk on the flat easily, but has trouble walking upstairs in the last 24 hours. Now, talking about the associated symptoms, she gives a history of coughing up phlegm, which is white in color, but today there is a case of she notices blood in it, that is for 1 day. Then there is no history of chest pain, palpitations, loss of consciousness, wheezing, fever. No history of flu-like symptoms or any leg or ankle swelling. There is no history of calf pain or tenderness. Now, talking about the past medical history, there is no history of asthma or any DVT or blood clots. Now, in travel history, there is a significant finding. So, the patient was on holidays in the States and arrived home 6 days ago. And during the flight, she took some sleeping tablets. Okay, so in the family history, there is no significant finding for DVT or blood clots. And then the patient, she is a smoker. She smokes 10 cigarettes a day, and duration is from her late teens up until about 2 years ago. And she drinks alcohol occasionally. In medication history, she's not on any oral contraceptive pills or any other medications. So these are the information provided for this case. And from this, what we can understand is that in any case where history taking is a task, there are a lot of information that we can find out so that we can come to a diagnosis. So what I recommend is that for every case, what we can do is initially we need to ask all questions regarding the history of presenting illness. And we also need to ask about the associated symptoms, along with a few questions regarding other symptoms to rule out the differential diagnosis. Then we can ask about is the past medical history, travel history, family history, and finally the personal history, where you will be asking about smoking, alcohol, any if the patient is on any medications. Now, coming to the second task, if you can recall, the task was to obtain relevant physical examination findings from the examiner. So in this slide, what you can see is the list of instructions that is given to the examiner for this station. You can go through them on your own time, but I have mentioned a summary for this. So these are the findings that you would like to ask to the examiner, which includes vital signs, that is pulse, BP, temperature, respiratory rate, and oxygen saturation. You also want to ask about the BMI, general appearance, and relevant pill cycloid findings. So pill cycloid, it stands for pallor, icterus, lymphadenopathy, cyanosis, clubbing, edema, and dehydration. Then you want to go through the cardiovascular system, respiratory system, abdominal examination, and extremities physical examination. So for this task, you do not need to perform any physical examination. You just need to verbally ask the examiner. But again, let me just remind you that no information will be voluntarily given to you. You need to be very specific for the findings that you're looking for. Again, just like in history taking, there is a very limited time for you in the exam. So make sure you ask only the relevant findings. So by relevant findings, I mean, any findings that will help you come to a diagnosis or that will help you rule out the differential diagnosis. So you want to be very particular about these findings. To summarize, in history, we have got these findings, that is acute onset of shortness of breath, an episode of hemoptysis, a positive travel history that has caused prolonged immobilization, and we've also got positive risk factors such as smoking and obesity. And on physical examination, we've got tachycardia, decreased oxygen saturation. So overall, our provisional diagnosis based on this is pulmonary embolism. Now we are looking at the sample mark sheet that is provided by AMC for this station. Okay, as we can see, the topic is shortness of breath. Now just look at the key steps. There are 3 key steps for this station. First one is inquired about history of recent travel. Secondly, requested measurement of oxygen saturation. And the third point is considered the likely diagnosis of pulmonary embolism. So you want to make sure that you cover all of these 3 key steps in your performance. Then let's look at the 4 domains given below. The first one is approach to patient or the relative. So I think personally, I feel like this is a very important domain, because it is important in all cases for AMC. Okay, so you have to be very empathetic towards the patient. You have to improve your communication skill. Just coming to a diagnosis and giving differentials is really not enough for AMC. You really have to make sure that you give a good approach to the patient. Now, the second thing is history taking, like we have discussed. Make sure you cover the major key points here. Then the third is choice and technique of examination, and make sure you are organized and have a sequence for this as well. And the fourth one is the diagnosis and differentials. Now, for this domain, what I suggest is that you just don't list out the diagnosis and differentials to the patient. Rather, explain a little bit about the diagnosis that you're thinking about, and also provide the positive findings from your history or physical examination for the diagnosis. And similarly, when you're explaining the differential diagnosis, give your reasoning as well. Okay, so overall, the passing score is 4 or more. So for each domain, you will be marked accordingly. Now, so based on the number of key steps that you have covered, and all the individual scorings that you have got in the 4 domains, you will get an overall score, which will determine whether you pass or fail that particular station. So this was the sample question given by AMC. I hope with the help of this video, you are able to have a general idea about what sort of performance is expected from us for this exam. And lastly, I also recommend you guys to go through AMC Handbook of Clinical Assessment. It is a very important book for this exam, and this book is published by AMC itself. There are almost 150 questions, and the approach for each of these questions are also mentioned here. And the approach is quite similar to the sample question that we discussed today. So yeah, that's it for today, and I hope this video was helpful. If you have any queries, please comment below. Thank you so much.